Hello viewers, I am registered nurse Adese and I'm speaking to you today on the word hypertension, medical term hypertension. Hypertension is a medical term, but it's also known as blood pressure or increased or elevated blood pressure. So we'll call it elevated blood pressure. When an individual or patient has elevated blood pressure, we diagnose this patient that this patient is hypertensive, or we say this patient is having hypertension. So let's go down to the definition of hypertension. What is hypertension? Today I'll be telling you on the definition of hypertension. I'll be telling you on the clinical manifestation of hypertension. That's the signs and symptoms. I'll be telling you on the risk factors, the predisposing factors of a patient or an individual to this hypertension. I'll tell you about the management of hypertension. Let's go to the definition of hypertension, shall we? What is hypertension? Hypertension is elevated blood pressure. It's an increased elevated blood pressure from normal. So we all know that the normal, according to WHO, the normal blood pressure is 120/80. That's the systolic as 120 and the diastolic as 80. So I'll tell you what this systolic and this diastolic is. Systolic is the top value and the diastolic is the lower value. That's in terms of fraction, we say the numerator is at the top, we say the denominator is what's below, right? So the systolic is the top value, that's the numerator. The diastolic is what's the denominator, which is the lower value, and they are all measured in what's millimeter mercury. So let's go to what systolic values are. The upper value, which is the systolic pressure, is the measure of the pressure of the heart when it pumps blood, when it contracts and pumps blood to the body. So the diastolic pressure, like I said, we have the numerator and the denominator. We're talking about the fraction of the numerator, which is systolic. So we're talking about the diastolic pressure, which is the lower value. Now we're talking about the 80 millimeter mercury. So that's the relaxation of the heart after the heart has pumped blood to that part of the body. So we have systolic and we have the diastolic. Thank you. So we've spoken about the definition of hypertension, and to bounce back and to recall, we said hypertension, elevated blood pressure, when the blood pressure is high, it's higher than normal. If it's normal, it's normal blood pressure. But since we're talking about hypertension, we're talking about an elevated blood pressure. We're speaking about the systolic and the diastolic. So we're talking about the risk factors, the predisposing factors of an individual having hypertension. So the first predisposing factor I'll talk about is family history. Most persons are predisposed to hypertension due to the family history. Most persons hereditary. That's what we say hereditary is genetic. In their family, in their bloodline, the third generation, the second generation, in their family, maybe it's either dominant in this generation and then recessive. But as far as we're talking about family history, something that is what's common with the family. So it's not a new thing. The person has it. Maybe this patient is not diagnosed. We will not see it as a new thing because my mom had hypertension, my father, or in their family they have hypertension. So that's one of the risk factors, the predisposing factors to hypertension. Then we have stress, high stress level. Some persons are prone to stress. They are exposed to stress. The work they do, nature of work they do, emotional stress, psychological stress. Thinking. Most times we say, oh, you think too much, you're thinking too much. Emotional stress. Then physical stress. Maybe the workload of work, the workload of wanting to make money, wanting to survive, hustle. The person is now working too excessively and then the person is stressed. Can be prone to hypertension because the body is trying to adjust with some stress levels. Then we have alcohol consumption. Some persons, I'm not saying taking of alcohol, you should not take alcohol, but you should take it at a minimal level. Most persons consume alcohol like food. They are addictive to alcohol. They are now abusing it. Some take it like a normal routine. And most persons that consume alcohol, high intake of alcohol can predispose you to hypertension. Then we have high salt level, high sodium level. Some persons consume salt a lot. Sodium, it's like one of the chemical compounds that makes up the salt. So consuming of high salty food, we are taking salty food, canned food, because canned food are processed and stored with low amounts of sodium. So when they consume all those things, it can actually cause hypertension. Then we have red meats. Consuming of red meats. Sometimes we advise patients dietary management, you avoid um, red meat. So when the patient an individual consumes red meat, it can actually metabolize, can be broken down, and then can be can cause a lot of fat deposits in the body. Obesity is also a risk factor of hypertension. People that are obese, so these are like few risk factors of hypertension I've mentioned. So we have symptoms, clinical manifestations, signs and symptoms of hypertension. As we all know, hypertension is a silent killer. Most persons just say, he just died, he just fainted. We don't know how it happened. So it does not really have any evidential, there's no, you not see someone walking on the road that you can be able to detect, so this person is hypertensive or that person looks hypertensive. But there are some clinical manifestations that come up when the person is what's hypertensive. The doctor can be able to say, okay, diagnose you, check your blood pressure, but first and foremost, an elevated blood pressure. So when your blood pressure has been checked and you said, okay, your blood pressure is above normal, that's one of the clinical, the signs and symptoms. Another sign and symptom we see there is dizziness. Patient complains of dizziness, patient complains of headache, temporal signs pointing out, it's paining me, I'm having headache here, I'm having weakness, I'm always weak, I'm always feeling this generalized body weakness, I'm always losing strength, I'm always sweaty and the like. So when the patient complains like this, but the first and foremost way to detect the patient of high blood pressure is what's checking the patient blood pressure. Then we have categories of blood pressure, of hypertension, of high blood pressure. Categories. We have, if I'm talking about categories, I'm talking about the normal blood pressure. Normal blood pressure, which I said earlier, 120/80. We have the stage 1, which is 142 or 159. Then we have stage 2 hypertension, which is 160, greater than 160. When patients having a blood pressure greater than 160/100. Then we have stage 3, or we see hypertension crisis, when it's beyond the normal range, greater than 180/100 or 120. You see the person's experiencing hypertension crisis, and there's some symptoms that are very, very common with hypertension crisis. That's when patients will now be predisposed to cerebrovascular accidents, patients will be predisposed to stroke, patients will actually fall into stroke. Patients will, I'm not saying that every patient that has 180 is always going to have stroke, but it predisposes you, it makes you prone to serious cerebrovascular accident, transient ischemic attack, and even aneurysm. Then talk about the management of hypertension. How do we manage hypertension when you're a patient or an individual that have been able to know, okay, doctor has diagnosed you from the beginning, you said, okay, it's above normal. How do you diagnose, how do you manage hypertension? So the first and foremost thing is what? Dietary management. You watch your diet, you avoid eating canned food, avoid eating red meat, you reduce your sodium intake, very, very important. Then exercise. If a patient is obese, we said predisposing factors of obesity. So we said if patient is obese, prone to hypertension. So if you're an obese patient, or even if you're not obese, you're hypertensive, we will encourage you to exercise regularly. Then we encourage patients to eat more vegetables. We encourage patients to hydrate, to take more water. We encourage patients to exercise regularly. Then to monitor your blood pressure effectively. We have ways you can be able to monitor your blood pressure. There's a device called the sphygmomanometer. It's a device that is used to monitor the blood pressure. We have the manual, we have the electronic. The manual sphygmomanometer, it's actually involves the use of the sphygmomanometer itself and then the stethoscope. So either a licensed or a clinician or medical, someone that can use it, and it is very accurate. The manual sphygmomanometer is more accurate than the electronic because it's just limited errors stuff, and maybe human errors can actually play a factor, but it is more accurate than the electronic sphygmomanometer. The advantage of it is that it can be used and it produces accurate results, while the electronic sphygmomanometer, it's an electronic device you place the cuff yourself. You as a patient can actually check your blood pressure yourself. The only disadvantage is that it can be prone to electronic errors. Battery can run down, it may be not charged well, it may be not functioning well. That's what the only disadvantage. But as a patient, you can be able to check your blood pressure yourself. Disadvantage of the manual one is you as a patient cannot check your blood pressure yourself. Then I'll talk about one of the things you should consider while checking the blood pressure is the cuff. That's what you place on the patient's hand. It should not be too big and it should not be too small. If it's too small, you have a false value which is going to be higher than the normal patient's blood pressure. If it's too high, if it's too big, you have a smaller value that is not accurate and to be falsely read. So you place patients in a sitting position, like I'm sitting, relaxed position. You place your patient in a sitting position, patient's arm. I as a nurse, I prefer to use the left arm because it's closer to the heart, so I can be able to get an efficient value. But any arm can be used. You place the cuff on the hand, you roll the sleeve. Patient is sitting down. We encourage patient not to eat, not to talk, not to do any activity while taking the patient blood pressure for efficient reading. Then you place patient seated upright. You roll the sleeves. Place patient's arm close to the chest. Then check the blood pressure. Then we have drug medications for hypertension. We have the ACE inhibitors, we have the beta channel blockers, we have the calcium channel blockers. Then we have the digoxin and diuretics. All these drugs, all these antihypertensive drugs can be used depending on the drugs that are prescribed to you by the physician. Then advise patient on lifestyle modification. Patient is always the smoking type. Patient is always the one that is consuming alcohol, like we stated earlier. We advise patients to cover those attitudes, cover those acts. Lifestyle medication. If you work you're doing, the work where you work, will tell you to consider changing what you do. Lifestyle modifications can also play a role of managing hypertension.